sabihin? Anong pagkakaintindi mo sa term na concealed? Lagi natin tong maririnig sa hospital when the doctors are explaining.
Concealed, ma'am.
Concealed. C-O-N-C-E-A-L-E-D. Concealed. Nakatago. Okay? Thank you, Ms. Kasal. No? Nakatago. So, pag naglibang ang inyong pasyente o black tarry stool versus hematokisya or fresh blood, mas delikado ang melena. No? Kasi black na siya, ibig sabihin concealed internal bleeding. Matagal na siya sa loob or nagsuka ang pasyente, dili siya hematemesis. No? Ang iya kay hematemesis is vomiting of fresh blood man na siya. No? Pero pag nag-vomit na ng coffee ground, no? You would also hear those terms in the hospital. Uy, coffee ground na ang iyang gisuka. So what does it mean? What do you have in your mind, no? Yan, nag-antibiotic ang patient. So meaning to say na siya concealed, nakatago na bleeding, no, sa iyang gastrointestinal tract. Mas delikado 'yon. And then alam na ninyo, you have in your mind na pag kinunan niya ng CBC or complete blood count, unsay mahitabo sa hemoglobin, taas or baba? What happens to the hemoglobin pag na concealed bleeding? You would expect that the hemoglobin is low. No, baba gyud kay na bleeding naman na mo nang hatagan na pud siya og blood transfusion. Okay? Mao nang gina-stop na pud ang antibiotic basig ang antibiotic ang ang precursor ana, no, or ang dahilan. Okay? So those are the things that you might encounter in the hospital having medications. Plus, ano pa yung natutunan natin sa mga gamot? Yung hypersensitivity reactions. No? Ano nga ang natutunan doon? Bakit possible ang mga hypersensitivity reactions? Number one, because of the immune system of that particular patient kasi magkaiba man ta. No? Another thing, ano pa yung natutunan? Ano yung tinuro ko? Na very, talaga din siya na magka-cause ng allergic reaction. Ano yung bagay na yun na tinuro ko sa inyo? Anyone who can still remember? Ano tong aritos, Mr. Charles?
Earrings po yan, ma'am.
Arito. Akala ko apelyedo. Sorry. Thank you, Charles. Okay. O remove the aritos or the earrings, please. Ha? O, ayan. So, sige daw. Check ko lang with section M. Anyone? O, di Kim Cheng, anong na-learn? Yung mga hypersensitivity reactions na ganap.
Kaya ba itong mga super infections, ma'am, inamin mo? Or
Ang,
likely siya?
ang super infection is the mutant bacteria, no, na pwedeng makuha ng microorganism from the constant exposure to antibiotics, just like the penicillin. No, kay si penicillin man ang pinakauna na nagawa sa market, no, nang kumbaga mo ana na si microorganism ay anad na ko sa imong penicillin, amoxicillin, ayaw na ko huraw-hurawa diha kay kailan ako sa imong powers kay ang imuhang power nadaot na ang imuhang beta lactam ring, nakuha na nako imong powers na ana sa ako karon imong strength. So resistant na ko sa imuha. So that's basically super infection. But hypersensitivity reaction, bakit kamo nangyayari ito? Especially with antibiotics kasi, di ba, meron tayong antibiotics. Of course, most of them are taken also from a bacterial source. Di ba? Yung ating mga, ano ba yung example? Sa kadami-dami na binigay ni Penicillium notatum, no? Mga aurifaciens, no? Yung mga ganong mga ganap na mga microorganism, galing din siya sa isang microorganism, no? So, gisynthesize lang yun siya, gitanggalan lang siya toxic, no, properties, kinuha yung kanyang, kumbaga yung kanyang particular component, no? At ginawa siyang gamot, no? And with that, we all know that these are exogenous substance, di ba? From the outside source. So pag binigay mo siya ngayon sa isang human being at nag-counteract yung mga cells ng tao doon, no, sa component ng gamot, kaya nagkakaroon ng allergies, no? Kasi nga outside source, exogenous siya. Like the insulin, naaman tayo human insulin, di ba? That's the regular insulin that we give to our patients, no? When we talk about diabetes mellitus medication, kasama ang insulin. Alam din ninyo na naikwento ko sa inyo during the prelim na ang insulin would also have the pork, di ba? Or the beef or the horse na sources, no? But more commonly, yung regular insulin na ginagamit natin is the human. Mo nang makita nato sa vial, human insulin ang nakalagay. Ibig sabihin, galing siya sa cadaver, 'di ba? Sa pancreas ng isang patay, no? Na individual, kumuha doon ng tissue at manufacture siya para makagawa ng insulin. So with that, human to human, so unsa may possibility ana, lesser ang chances of your allergic reactions. Naintindihan. But somehow, even how simple the medication is, even with a simple biogesic na agi nag-react na individual. No? Kaya, paano natin malalaman na na-reaction? Of course, the patient has to take that medication and to see. No? Kaya, kayo, nurses, student nurses, no? Kailangan natin magbantay, no, ng mga reactions pag nag-inom ang pasyente ng gamot, especially for the first time. Naintindihan? Ha, dili lang kayo maghatag kag tambal hello and goodbye dayon ka, no? Kasi anything can happen to your patient, no? Most especially, alam na ninyo na pag in-inject yan, ang bioavailability is 100% compared to that is taken per orem na 50% ang iyang bioavailability kasi marami pa siyang dinadaanan, no? Na expose pa siya sa different enzymes, secretions, and all, no? Dumadaan pa siya ng different stages like the absorption, no? You have the distribution, metabolism, and excretion. Most especially pag PO kasi dumadaan pa siya sa GI tract. Alright, ha? So, yun ang mga importante sa mga gamot-gamot. And more importantly, napag-usapan natin ang different na mga pangalan ng gamot, different classifications. At least by now, compared to when you were still in level 1, no, wala pa kaayo din siya na klaro, no? Wa pa mo kasabot na ang beta blockers di ay duha di na siya. Mo nang kinahanglan tan-aw nako na cardio selective lang din siya. Kay kung non-selective beta blocker siya, maapektuhan pod ang beta 2 which causes bronchoconstriction na pwedeng dili ka ginhawa ang pasyente nga naay asthma nga nag-take og non-selective beta blockers, di ba? So naintindihan niyo 'yon? No, are you happy with that? Are you appreciative of those things na na-learn ninyo sa pharmacology? Mr. Romero, Leonard, may natutunan ba? Okay? Kasi importante, kasi ang bread and butter natin or ninyo is bibigay kayo ng gamot. So I suppose, pag naghatag ng mo tambal by your own, pag mag-graduate na mo, mag-practice na mo, as a nurse, good RN, no? I hope na ma-remember ninyo, uy, si Ma'am Aya Haitin, no? Ito yung na-share ni Ma'am Aya, no? Yun ang nakakataba, no? Sa aming mga puso, no? Pag na-appreciate niyo yung mga tinuturo namin sa inyo. I know na tiring, kabalo ko tiring, na nata sa finals, pero laban lang. Laban lang yun. Okay? Kasi kayo din naman ang gumagawa ng grades ninyo. No? Kamu man, di ba? Easy lang man po akong quizzes. No? Quizzes are basically taken from the things that I have shared. Alright. So ngayon, ano ang ating i-expect for the finals. Pag-uusapan natin ang respiratory medications, no? Respiratory medications are divided into two, no? So meron tayong mga simple, no, na nabibili natin over the counter, yung ating mga antitussives, yung ating mucolytics, no? Meron din tayong expectorant, no? Pag-uusapan natin yan siya one by one. And then for the respite 2, ito yung mga medications na kailangan talaga natin bantayan, dobleng bantay, no? Kasi a lot of like side effects would happen since the respiratory and cardiovascular system, pag sympatholytic medications na aapektuhan din talaga yung isa, which causes tachycardia, no, in return for bronchodilation. Diba? Kaya katong primero, nagababa ang heart rate pero na ay bronchoconstriction. Dito naman sa respite, nag-bronchodilation pero nisaka na po iyang heart rate. No, kasi naapektuhan si beta 1 receptor. So mao na siya ang ato ang bantayan. Okay? Medications for asthma, no, I know, I suppose na ay mga asthmatic diri nga naga-take pod ng mga maintenance medications, no? Kasi kailangan din ng maintenance medications for asthma para dili mag-surge ang patient into status asthmaticus, no? Naatay isa ka estudyante, SPCian before, supposedly nag-graduate na good siya last, no, nitong nakaraang school year, pero hindi siya umabot hanggang first year lang sa college, I think, or second year college, no, kasi nag-trigger ang kanyang asthma, no, nag-inom sila with friends somewhere in Santa Ana Avenue lang, hindi niya nadala ang kanyang bronchodilator pa. Tanaw ni mo sa kaduol ang Santa Ana o San Pedro Hospital. Pero since na ay bronchoconstriction, nag-status asthmaticus siya kasi nag-inom, siguro nagsigarilyo or whatsoever, hindi na nagdala yung kanyang emergency puff. From Santa Ana to San Pedro Hospital, wala na siya nakaabot. No? Kay wala, namatay siya. Wala natabang because of that danger. Kaya na ay maintenance, no, for those who are asthmatic. Importante talaga. Kaya na may mga triggers for asthma. Di ba? Na ay mga triggering factors. Alright? Tapos, kasali din sa respite ang TB medication. So, yun ang pag-uusapan natin today, yung ating medications for TB. Napag-usapan na ba ito sa community, health nursing, Ira Marie Nofable? Ang anti-TB medications, na may idea, Ani?
Ang ano po, ma'am?
Anti-tuberculosis meds.
O, wala pa po ata, ma'am.
Wala pa na
So,
pag-usapan,
yes
no?
po, so far.
But pulmonary tuberculosis is also one of the most common disorders, no, for Filipinos. So kung nag-community health nursing mo, naagir TB day, no, naagir tuberculosis day ang clinics, no. Before, it's basically every Friday man siguro to nga ang mga pasyente nato sa clinics would be yung mga possible na TB, no, or katumagat nag-take na ng anti-TB medications kasi diagnosed na sila. And in the hospital, pag na-expose kayo, I know that you are exposed right now. You are now not 100% sure, no, na inyong take care na ana dahil na TB. No, mao nang Filipino nurses, no, pag nag-test ta sa ato ang anti-TB test or TB skin test, no, or the PPD or the purified protein derivative or the PPD testing. So pag nag-skin test ta ana, no, after 24 to 48 hours, no, naada yung tayo reaction ana, no? Nagpa-positive talaga tayo because we are already exposed. I for one, no, pila na ba ko ka years? 30th year na namo karon as a nurse, no? Karon na year 2022, our batch is celebrating our 30th year, no? As a nurse, kamo wala pa kay wa pa man mo na-graduate, no? So with the 30 years nga exposure ni Ma'am Aya sa hospital, no, gikan pag plus additional pa 3 years, no, kasi second year nag-duty na mi eh. So that's 33 years na exposed. No, so pag i-PPD test ako, kasi mahitabo positive yun, no? But it does not mean na positive ko sa TB. It means nga naanak ko'y immune cells nga na-develop. I have already my own antibodies, no, to fight against tuberculosis, no? Kaya yun ang itinaganda. Aside from taking medications and supplements, binigay ni Lord sa atin ang ating immune cells, no, to protect us from having the disease, no? Kasi yung ating katawan mismo, no, yung ating soldiers for protection, yun ang gumagawa ng paraan, no, para malabanan natin ang mga different microorganisms. Kay COVID, no? 'Di ba? Your realizations with COVID, 'di ba? Nabakunahan na tayo, 'di ba? Meron pa ba dito na wala na bakunahan? I suppose wala na, kay requirement man yun na siya. Compared to 2020, no? Or 2019 ba to siya or 20 nga nag-start din siya. 'Di ba daghan kay nangamatay? And we are now 2022. So unsa man ang COVID, no? Nag-positive ka sa COVID pero nag-ubo, no? Sipon, mild lang siya compared to the past years because that is our immunity that we got, no, from the vaccinations. No, kaya yun ang kinaganda. Plus exposed na pagyud ta, no? So later on dili na ta magmask, no? Magkasakit man galing ta og COVID, magpositive man galing ta, pero mild na lang siya. So that's the beauty of our immune cells. Just like TB also. Okay? Nga sa 33 years ko, exposed ako in and out to the different hospitals, to the different community, different people that I mingle. And you all know that tuberculosis can be taken from droplet infection. Okay? Kanang sneezing, coughing, talking, so mura po siya COVID. No? Musulod siya sa respiratory system. And it causes proliferation of this bacteria. Okay? So we will start na. Time check 9:46. I saw Guadalquivir came in just right now. Kindly
Yes,
acknowledge. Okay. Guadalquivir, okay lang ba?
Yes, ma'am.
Okay. Can you see my slide now?
Yes, ma'am.
All right.
Yes,
So
po,
I
ma'am.
will start discussing the anti-TB. Okay? So just stay put there. If mahina ang inyong camera or connectivity, no, you may take off your camera. But for those who can still open the cam, much better. Okay? Sige. So we will talk about anti-TB, no, medication. So pag sinabi nating tuberculosis, it is brought about by a microorganism, no? An acid-fast bacillus, okay? Acid-fast bacillus termed as, of course, your Mycobacterium tuberculosis, okay? Mycobacterium tuberculosis, acid-fast bacillus. Ang pag-check din ito, ginagawa, of course, ng medtech at hindi ng nurses, no? Meron silang reagent na nilalagay sa sputum, kaya sputum test ang ginagawa para ma-identify ang presence ng Mycobacterium tuberculosis. Nagkakaroon ng color changes, no, once na nailagay sa Petri dish yung reagent na ginagamit, no, to identify this acid-fast bacillus, no, nagiging red stain. Instead of a blue stain, nagkakaroon ng red stain, no, na nakikita nila sa microscope, which would be identifiable for an acid-fast bacillus, no, which is the Mycobacterium tuberculosis. Okay? And this Mycobacterium tuberculosis would also be identified as a tubercle bacillus. Okay? Tubercle bacillus. It's basically rounded, no? It's a rod shape, no? Microorganism which causes infection, no, brought about by this Mycobacterium tuberculosis, no? So pwede din siya maging term as tubercle bacilli, itong Mycobacterium tuberculosis being checked over the microscope. It's basically slow growing, it becomes dormant, okay? And it exists inside the cavities called tubercles, no? Since it is dormant, so meaning to say, nakuha mo siya ngayon na year at pwede kang mag-manifest, no, ng coughing, no, and problems and manifestations in relation to TB after a year or so, no? Kasi pwede siyang magstay lang sa lungs ninyo and it exists in the lung parenchyma, causes destruction. Basically, the cavities, no? Bangagan niya, no? Bangagan niya. It has a capacity to be dormant. Magbalay siya dito sa imuhang lungs and it basically forms cavities, no? Kasi doon siya nag-proliferate. And these cavities are also called tubercle, no? Yung cavities na nakikita over the X-ray. And it is transmitted, no, ang Mycobacterium tuberculosis can be transmitted through droplets, no, dispersed in the air through coughing and sneezing. And ano pa ang consideration natin, no, ng Mycobacterium tuberculosis? It has an outer coat, no, consisting of a mycolic acid. Okay? So, mycolic acid, no? Ito yung outer coat ng tubercle bacilli or the tubercle siya, no? Kasi it can actually cause cavity formation and as you can see, no? Sa loob ng tubercle bacilli, naapod din siya tubercles, no? Or mga cavities there, no? Na andyan yung kanyang nucleus, andyan yung power ng microorganism. Okay? Rod shape siya. What is this mycolic acid? It's basically the same with a fungus, no? Slow growing man po ang fungus, difficult to manage because they have this outer coating. So, ibig sabihin, si Mycobacterium tuberculosis, no? Pinsan niya ang fungus, no? Slow growing, it has the outer coat, mycolic acid, no? It's basically forming the cell wall, no? Cell wall of the Mycobacterium tuberculosis, which has the ability to become resistant, no? To be penetrated by anti-infectives, no? Kaya nado siya specific na tambal, no? Dili lang siya ordinary na penicillin or cephalosporins, no? Meron talaga siyang ginawa na particular antibiotics or anti-infectives, no, to actually fight with this mycolic acid structure as well. Kaya napod siya yung management ng multi-drug therapy, very necessary because the Mycobacterium tuberculosis is dormant, slow growing, and resistance is very, very common, no? Pag hinayaan lang talaga siya, no? Maski ano ang gitake ng mga antibiotics, no? Kaya meron talaga mga first line na mga gamot na binibigay for those patients. And sa clinics, no? Sa community health centers, the team would consist of the doctor, the head doctor, the nurses, as well as the barangay health workers, no? Ito yung team na nakikita natin, no, sa hospitals which they belong to the DOTS, no? DOTS, naririnig niyo na yan siya over the TV, radio, at saka later sa community health centers na atay DOTS facility. No, what is the meaning of DOTS? No, so you have the direct observe treatment short course or the DOTS. Okay? Or directly observe treatment short course. No, ito yung program in managing and treating tuberculosis in the community. Okay? So, naay mga healthcare team, no? Kasi itong mga BHW and the rural health nurses, no, RHU, sila ang muadto pod sa community para mag-check kung kumusta na ba itong mga pasyente nila. Kasi before, wala pa'y dots kung sa'y mahitabo sa ato ang community health centers. Ang mga pasyente nga na-diagnose, they would go to the clinic and they would just ask for the multi-drug therapy. So, binibigay naman sa kanila iyon. Pero unsa may ibuhat sa taga-bukid or taga-province, Mr. Ocampo, paghatag sa tambal dito sa inyong client, unsa kaya imuhang mahuna-hunaan na buhaton ani sa mga taga far-flung areas?
I-take lang dito sa ma'am.
Okay, pataka lang sila take diretso lanlan no sa tambal. No, kay wala ba sila proper education? Or worst case scenario that had happened, ang tambal gibaligya pud nila didto sa ilang mga silingan, no? Nakakwarta sila ani unya katupog silingan, ang iyang problema sakit sa tiyan, nag-inom siya og anti-TB medication kay antibiotic man daw, makatambal man daw sa tiyan. No? So kaya yun ang nangyari, kaya the government, the Department of Health instituted these concerns via forming the DOTS facility, no? Na ang mga pasyente na karon ang muadto sa health center plus ang mga BHW nurses would visit them, no, sa ilahang balay, no, para nana sila record, no, and to the point na ang BHW na po ang magpainom jud sa pasyente, no, sa tambal, no, para maiwasan na tong mga problema. Kaya beforehand maraming mga relapse, no, na ay mga pasyente nga nagkaroon na ng kumbaga extra pulmonary tuberculosis, no, kay wala man sila na ayo, kay wala dahil nila gina-take, no, ang medication ayon sa instructions, no, ng clinic. Okay? So kaya ito siya. Kailangan ng mga first line agents, no. This one is an example of the acid-fast bacillus that I mentioned a while ago, no, na ay a red stain na nakikita over the Petri dish or the microscopic sample, no, instead of the blue one. So pag ganito ang lumalabas sa sputum, no, ng pasyente, positive na dayon siya for Mycobacterium tuberculosis, no? Pero hindi lang ito siya ang diagnosis, no, but the sputum AFB or the acid-fast bacillus sputum AFB test, no, is of course noted to be the gold standard, no, diagnostic test, no, to know if the patient has positive tuberculosis, but it has to be taken or it has to be checked 3 times, no. 3 samples ang kukunin ninyo sa pasyente, no, in the hospital. Pag mag-sputum AFB, 3 sputum cups ang binibigay, no, para ma-check talaga yung 3 samples, no, para sure talaga na positive talaga si patient, no. So in the hospital, pag naka-encounter kayo ng pasyente for sputum AFB testing, so usually 3 specimens ang gina-collect. So 1 upon waking up, and then the second test will be like after the patient has taken breakfast, so maybe at around 10 o'clock, and then the other one, pwede na po siya after lunch, no? So mag-send na naman siya ng sample. So that's basically 3 tests, 3 specimens, sputum. So pag sinabi natin sputum, dili saliva. It has to be with mucus, no? Phlegm ang sample, no? Para ma-generate talaga ang factual result, no, for the sputum AFB testing. But we also have the gene expert, no, the sputum gene expert test, no. Yun ang bago ngayon. Ano ito siya? machine ito siya, no, na available na sa mga centers, no, accredited of course by the Department of Health. So anong kinaganda ng gene expert test? Ika-isa na lang mag-submit og sputum sample, and as fast as 30 minutes to 1 hour, nare-read na ang result. Nasabtan? Okay, meron tayong ganito, I know one in MDMRC, no? Sa Metro Davao Research, no? Hospital in Bahada. Pero kailangan, bago ka makapag-send ng specimen mo for sample, dapat meron siyang request, no, from the pulmonologist, no? Or from an infectious disease doctor, no, na para ano siya, ma-send yung sample sa laboratory at ma-check siya through the gene expert test. So that's the newer version of the sputum AFD. No, kay katumang kung ordinary na sputum AFD, unsa man ang atong mabalaan ani. Ang watcher, kwaon niya ang sputum, of course sa iyahang pasyente, ang tulo ka samples ana dalahon niya sa Department of Health. Asa man ang DOH diri sa Davao City? Asa man na siya located ang DOH? Anyone? Nurses?
Sa San Pedro dapat ma'am na church dito sa balapit lang sa ano tayo, Municipal Hall po.
Naa ba didto sa
Ano,
ato
ma'am,
ang
sa
City
SMC?
Hall? Dili. No, ang
SPMC
ato ang
dapat.
DOH nasa SPMC, correct. No, katong dako gani kay na building, no, atubangan sa SPMC and along Bahada, no. So andoon na ang DOH, and doon din ang area, no, for ay kay Ma'am Heronan, kay special exam. Thank you. Okay? So doon dito pa nila ginasend, no, ang ilahang samples. So very tasking also to the watcher and to the hospital. Kaya ngayon, within the hospital, no, naanay ma-acquire na gene expert testing, no, na equipment na mas madali at isang sample na lang at mas mabilis lumalabas yung result para matreat kaagad ang pasyente. Okay? Kaya meron tayong mga different medications or mga first-line medications intended to treat tuberculosis kasi slow-growing nga siya, difficult to manage, no? So kaya specific din siya with the Mycobacterium tuberculosis. And we have to prevent extra pulmonary tuberculosis to happen or kanang mga relapse cases, no? Mga relapse ni balik kay wala na ayo. No? Tapos pag ingon ani, difficult na siya to manage, no? So maa-admit na ang pasyente and more high-end anti-TB medications would be given to the patient. And worst case scenario, pwede pa maapektuhan ang other areas like the bones, no, and the meninges, no, nang naatay TB of the bones, which is termed as your Cox disease, no, KOCH. Cox disease or TB of the bones, naapod tayo TB meningitis, no, na difficult to manage kasi apektado na ang central nervous system. No, nag-travel na ang Mycobacterium tuberculosis dito sa meninges, no, sa CNS. Kaya naga-seizure ang pasyente, naga-coma na ang pasyente kasi affected na ang iyahang central nervous system. Okay? So we have the medications, no, we term this one as RIPE, no, R-I-P-E, no, with the S, no, kasi yung S is pangdagdag yun siya in cases na naga-relapse or wala gihapon na ayo ang pasyente. So the R would be the rifampicin. Okay, so this would also be considered as your very important medication for an TB, no? Dili pwede nga wala ang rifampicin. Okay, so you have the mechanism of action. It slows down, no, the growth of the DNA and the RNA of this bacteria. Ang side effect niya naman na kailangan natin always i-check at ituro sa ating pasyente, it causes discoloration of secretions or body fluids such as the urine, no? It causes orange colored urine or body fluids, no? Ano itong mga body fluids? Feces, saliva, you have the sputum, pwedeng ang luha ng pasyente na apoy color orange, no, for that matter, but it's basically harmless, no? What do we do? Constantly inform ang pasyente na increase lang po ang fluid intakes, no? Okay? And the medication is hepatotoxic, kaya very important ang liver function test, no? Especially the SGPT of the patient, no? Kasi pwedeng tumaas at pwedeng disruptive din siya sa liver. Okay? So, the medication is or can be taken on an empty stomach. Okay? Kung naay gastric irritation, so you can also take, no, small frequent feedings, no, for the patient. Then you have to protect the medication from exposure to light because the medication can be altered because of the exposure to light, no? Kasi photosensitive yung gamot mismo, no? Nagdi-discolor yung gamot. Kaya yung packet ng rifampicin or yung bote is being stored on a brown or dark container, no? Kasi photosensitive ang rifampicin. Okay? So the next one is the isoniazid. It is also considered as a primary anti-TB medications or the INH, no? Isoniazid, it's bactericidal, and what is also a concern for us in here is that it actually blocks, no, the vitamin B6, no, which is used for intracellular enzyme production. Okay? So, vitamin B6 is needed for DNA synthesis, kaya nagkakaroon ng side effects, which is also disruption of the cells, no? Causing peripheral neuropathies. Okay? Yung mga kamay, yung paa ng pasyente, nagmamanhid. So, there is basically numbness, tingling sensation, burning sensation of the hands and the feet because of the blockage of the vitamin B6. Kaya, gina-institute natin, pwedeng mag-take ang pasyente ng supplement B6, no, which is the pyridoxine, 10 to 50 milligrams, no, is prescribed to the patient to avoid peripheral neuropathies. Okay? Your vitamin B6 can also be taken from food. So, pwede po ka mag-health teaching, no, to increase taking of cereals, no, para makapagbigay ng additional B6, no, from the food, poultry, and beef products. Pero dahan-dahan lang din sa beef, no, because of the cholesterol levels. And the isoniazid would also have the hepatotoxic effect, no? Hepatotoxic po din siya, kaya checking also for the liver function test. And the isoniazid is taken before meals. Then the next is the PGA or the pyrazinamide. Bacteriostatic and bactericidal siya. And ang concern natin dito is the hyperuricemia. Okay, and it is also photosensitive. Okay, the drug itself is photosensitive as well as to the patient. No, nagkakaroon ng contact dermatitis, di ba? Pag too much exposure to the sun. Hepatotoxic and ototoxic. So, ang PCA, maraming problema. No, nakakapag-destroy siya ng liver in cases na hindi na-follow ang correct dosage and taking of the medication. Ototoxic, you have the cranial nerve number 8, no? So, there would be tinnitus or problems in the hearing sensation of the patient. Plus, it has the capacity to increase the uric acid formation, no, in the system. So, unsa man pag may hyperuricemia, unsa gani ang problema sa pasyente, Miss Lamoste? Pagtaas ang uric acid, unsa may manifestation? Miss Lamoste. Micaela. Miss Lamoste, can you hear me? Hala, nadunggan ba ko ni Micaela? Nakadungog ka sa ako, ah?
Tungog bang pero hinay sa ko mo.
Unsa may hyperuricemia?
Ma'am, diabetic. Di ko sure.
Unsa man ang manifestation? Anyone from the class? Pag naay hyperuricemia, unsa may?
Magsakit ang bones, ma'am, ang
Yes.
joints.
Correct, Mr. Devino. Gout, okay? Masakit ang joints, so you have arthralgia. That is the term for joint pains, no? Mao nang kailangan tambalan pod, no? Kay magsakit naman ang tiil sa pasyente pod, no? There are cases na magsaka iyang uric acid, so pwedeng bigyan ng non-steroidal anti-inflammatory medications or the NSAIDs, mefenamic acid, no? Ang pasyente just to or kadtong mga tambal na non-steroidal, unsa ganina? Alaksan, okay, kana mga ingon ana, because those are NSAIDs, okay? Then you have the ethambutol or the EMB, okay? So this one is bacteriostatic, and ang problem nito is the vision, no? E is for the eyes, okay? Kanang mnemonics na to. E is for the eyes, so it causes visual disturbances, kaya dili din siya ginahatag for children below 6 years old, no? Because they cannot be reliable to monitor their vision. So, sa mga tigulang, usually, no, bantayan po nato pag naka-treatment ang pasyente for 2 to 6 months kasi ang treatment nitong anti-TB medications, the RIPE, okay, rifampicin, isoniazid, ethambutol, and the pyrazinamide, no, mo nang naay mga side effects na lumalabas. Etong sa ethambutol is the optic neuritis, okay? So it affects the red and the green discrimination, dili na siya makaklaro, especially pag mag-drive, delikado po siya, no? Kaya dili na siya maka-identify sa traffic signs, pwede siyang ma-aksidente, no? So in such cases, pag nagkakaroon na ng problema, no, pag apektado na ang red and green discrimination, pwede na siya i-refer also sa ophthalmologist or discontinue na ang tambal, okay, and have the patient have the eye exam, okay, para lang ma-check lang, no, kasi baka pwede pang mabulag ang pasyente. And it is also affecting the kidneys, etong ethambutol, no? Others would affect the liver while the ethambutol would affect the kidneys. And then, dinagdagan ng streptomycin, which is an aminoglycoside antibiotic, no? Pag nagkakaroon na ng relapse, no, or mga hindi gumaling ang pasyente with the first 4 to 6 months taking of the PO medication, RIPE, no, kaya dinagdagan ng S, kaya RIPES, no, that is the streptomycin. And streptomycin is the only anti-TB medication na binibigay intramuscularly. Okay, and we also have discussed streptomycin causing ototoxicities, no? Katong nag-istorya ta about aminoglycosides, and student nurses would also check for pain on the injection site. Okay, so pag naay injections, ang pasyente, warm compress, and we have to rotate the injection sites kasi everyday ito siya na gina-inject sa pasyente for a month or so. Depende sa management sa doktor at sa diagnostic test, evaluative test na ginagawa sa pasyente, no? Kung naayo na ba siya sa iyahang sakit, no? Or wala na ba siya mga manifestations as well. Being checked over the sputum test as well as with the chest x-ray, no? So everyday mag-adto ang pasyente sa clinic, magpa-inject siya. Right, left, right, left. Kasali ang Botox, no? Kasi gina-inject po siya sa vastus, sa gluteus muscles ng pasyente sa Botox, no? Kasi hindi pwede na parati na lang sa kamay, no? Kasi pain on the injection site would also be a problem. Okay? So, kana. Ang bantayan po ani is the ototoxicity or the cranial nerve number 8 damage. Okay? Pag hindi pa talaga gumaling si pasyente after so many months, no? Nagkaroon ng problem, nagkaroon na ng lung infection ang pasyente, kay immunocompromised, nag-pneumonia, adto na siya sa hospital. Okay? At ito na yung mga second line medications na binibigay sa pasyente. Okay? Kasi ang ipe-prevent natin is, again, yung extrapulmonary tuberculosis. No? Instead na lungs lang ang apektado, pwedeng mag-sepsis ang pasyente, mapunta sa dugo ang TB, microorganism at maka-apekto sa brain at saka sa bones, no? Kaya etong para-aminosalicylic acid, okay, kanamycin, cycloserine, and the capreomycin. So these are second-line anti-TB medications na binibigay sa pasyente, mga broad-spectrum anti-mycobacterial medications. Ito siya. And usually, it is being given in the hospitals na through intravenous administration. Okay? Since ang concern natin, marami masyadong dinatake ang pasyente, di ba? Just like the HIV, no? Yung ating heart treatment for the HIV. Ang ginawa naman ng pharmaceutical companies is the combination. Okay? So kung ang iti-take ni pasyente is the rifampicin, INH, and the PCA lang, so combi pack. Pero pag dalawa lang, no, rambutol naman yung kanyang iinumin. Pero pag kompleto na right, you have the myrin tea. So this is also common in San Pedro Hospital na binibigay ng student nurses sa pasyente. Itong myrin tea kasi isang gamot na lang siya which actually have the right, no? Kompleto na siya. Rifampicin, isoniazid, pyrazinamide, and the ethambutol. Okay? So, mga fixed doses na siya, just like this one. Okay? The myrin tea, kompleto na siya. 1 tablet na lang. So, ito na ngayon ang iniinom nila para di na sila malibog sa upat katambal na ilahang tumaron. But nonetheless, ang atong i-consider would be the different side effects, no? Na pwedeng i-manifest ng pasyente, orange-colored urine, peripheral neuropathies, you have visual disturbances, ototoxicities, hepatotoxic, and the nephrotoxicities, no? Kaya before din mag-take si pasyente ng anti-TB, multi-drug therapy, ano ang kailangan i-test sa pasyente? Number 1, kailangan i-test ang kanyang creatinine, no? Na dapat normal ang creatinine levels, no? Just to check for problem sa kanyang kidneys. Number 2, mag-liver function test ang pasyente, no? So titingnan din yung ang capacity ng kanyang liver, kung kaya ba nito mag-inom ng gamot, no? Kasi naatay mga hepatotoxic medications just like the rifampicin and the ethambutol. Okay? So, kailangan okay din ang pasyente. Okay? Number 3, kailangan kumain ng maayos ang pasyente. No? Kasi pag na-ay TB, magpayat, muscle wasting would also be a sign for that. No? So, dapat good ang appetite para mas lalo siyang ma-manage ng maayos at magaling talaga siya sa sakit niya, no? By eating healthy. Okay, so those are the considerations that we have to institute, no, for our patients, no, para gumaling siya sa TB. Plus, taking of the medications religiously and constant follow-up. So, eto naman ang different categories, no. For the PTB, kasi naatay category 1, category 2, category 3, and category 4. Bakit kailangan natin i-categorize? Kasi meron tayong pina-follow, no, na protocol on how long the patient will take, no, the anti-TB medications, multi-drug therapy. Okay? So pag na-categorize ang pasyente with number 1, okay, ito yung mga types of patient na nabelong sa type 1 or category 1. No, new smear positive, no? PTB, ibig sabihin nag-positive siya sa sputum AFB or sa gene expert test, pasok siya sa category 1. Pag nag-negative naman siya sa sputum AFB pero nakitaan siya ng extensive lung parenchymal lesions or cavitation sa X-ray, pasok din siya sa category 1. No? Plus kanyang mga signs and symptoms pa na nakita sa kanya. And yung mga pasyente na having HIV disease, no, which can also be considered to have extrapulmonary tuberculosis, no? Tapos nakitaan pa talaga itong HIV patient ng positivity sa kanyang smear or may nakita na parenchymal lesions over the chest X-ray, considered siya as category 1. So, ito ngayon ang ibibigay sa kanya, 2 months intensive phase ng HRZE. H here, HERZE. Kasi ganito din ang ginagamit, no, sa Department of Health. H is the isoniazid, no? Or the INH, no? Kaya siya H, no? So, that's the isoniazid, rifampicin, the pyrazinamide, and the ethambutol, or the HERZE. Pwede po siya right, pwede po siya HERZE. So, 2 months siya sa 4 na gamot and then additional 4 months for the isoniazid, no, and the rifampicin. Okay? Kaya ang isoniazid and rifampicin is basically, no, our first line anti-TB medication. No, that's for category 1. Naintindihan? Clear ba? Ha? 2 months ang right and then additional na 4 months, no, for the INH and the rifampicin. Okay? Pag category 2, no, ang kanyang type is treatment failure or relapse. Ano itong RAD? Sorry. RAD is return after default, no? Kasi hindi siya nag-inom ng right, no, for that intensive phase, no? Or the continuation phase, wala pa rin nangyari, or other extrapulmonary severe cases, treatment failure siya basically. So, ang ginagawa is 2 months, no, of the HERZEs, or wala, pwedeng hindi bigyan ng streptomycin, and then you have additional 5 months of your INH, rifampicin, and plus the ethambutol. Okay, so dinagdagan siya. Yun siya, pag category 2 siya, no, na na-diagnose sa health center. Okay, ang category 3 naman is yung mga asymptomatics, no, wala naman siyang mga manifestations, considered siya as category 3, and new smear negative PTB with minimal parenchymal lesions. Okay? So, ibig sabihin, pag-test sa kanya after 6 months, no, nag-negative siya sa smear, pero nakitaan pa rin siya ng minimal parenchymal lesions plus asymptomatic naman siya. So, eto ngayon ang binibigay sa kanya. Additional na naman na 6 months ng RIPES and the isoniazid and the rifampicin. No, just like the category 1. Okay? So, nag-6 months siya dito. Pag category 3, mag-additional na po siya 6 months, no, na treatment. Okay? And then for the category 4, ito yung mga gina-consider na chronic cases, no? So, hindi na talaga na nagamot, no? Naga-worse na ang case ng pasyente. So, gina-refer na ito siya sa National Tuberculosis Program Coordinator or the DOTS facility, no? Kasi baka kailangan na siya i-evaluate ng infectious disease doctor, no? Kaya nag-worse na ang kanyang case. Okay? So, na-consider siya as category 4, no? So, this would be the treatment management for a while. Yes, Miss Lebrillo.
Ay, ma'am. Ay, clarify lang pa ko yung H, di ba pa is yung INH po.
Okay, isoniazid siya. Kasi ang meaning ng INH no, is isonicotinic acid hydrazine or the isoniazid.
Okay.
Gi-share ko lang din ito sa inyo, itong HERZ, aside from the right, no, kasi para ma-familiar din kayo, kasi some of the DOH facility or health centers, HERZ ang kanilang ginagamit. Okay? Sa student, very familiar kayo sa right, no? Pero in the clinics kasi, in the centers, ito yung ginagamit nila para at least familiar kayo. So H is for the isoniazid, R is for the rifampicin, Z is for the pyrazinamide, and the E is for the ethambutol. Alright? So I hope that is clear. So mag-category muna yan siya, no? Sa health center, i-categorize yan siya according to the smear, according to the chest x-ray result, according to the history of the patient, as well as with the manifestations, no? Para naa sila'y guide on the intensive and the continuation phase. So, etong category 3, as I had mentioned, galing na siya ng category 1. Nag 6 months na siya og treatment. But nonetheless, naagihapon siya lesions, pero wala siya signs, pero naagihapon nakita na cavitations, although nag-negative siya sa iyang smear, magpadayon gihapon siya og another 6 months of intensive and continuation phase. Yun siya ang ating fina-follow. Ha? Did you get it? Kaya lang, ang kinaganda nito, instead na 4 na gamot ang ihang tambalon, kaya naa naman tayo fixed doses, isa na lang katableta iyang inumon. No? O kanipod sa ethambutol o sa isoniazid o rifampicin, so napod tayo fixed dose ana, isa lang pod ka tableta na lang ang inumon sa pasyente. No? Para di na dahil siya malibog. But nonetheless, what is important in here, no, section M, is the side effects of the drug na doon kayo magbibigay ng health teaching sa pasyente. Ma'am, nag-contact lens man ko, ma'am, kay di man ko kakita. Ma'am, ayaw lang usa og gamit sa contact lens, ma'am, kay na ay tendency na mag-orange ang imuhang, mag-watery eyes ka, tapos mag-stain sa imuhang contact lens, ang orange colored na secretion, gikan sa imong mata, ma-stain siya sa imong contact lens, dili na inon kakakita. Ana, good siya. Kaya pwede man po siya sa tears, pwede po siya sa saliva, sa iki, no, na orange colored siya, but it's basically harmless. What we have to do is to monitor, especially the creatinine, plus increase oral fluid intake po tayo. Okay? So, ganoon ha? Kasi some of you might be working in the community later, no? Mag-community health nurse mo. No? At least you already have the knowledge on the different side effects of this anti-TB medication. Okay? Why is it important? Again, bakit meron tayong multi-drug therapy? Very necessary because mycobacteria is slow growing and resistance might be common. No? Kasi the more na it is dormant, the more that it has power, no, to become resistant to the medication. I hope that is clear. All right? So these are important things also to consider, no? We also have prophylactic anti-TB medications, no, especially given to close contact, no, with TB persons, those who are positive for HIV, those who are positive for TB skin testing or the uh, purified protein derivative for young children. So, pwedeng mag-prophylaxis, no, with the use of the isoniazid for 6 months to 1 year. Okay? And this is, of course, being prescribed by the doctor. No? So, pag HIV positive ka naman or TB skin test positive, okay? Ito yung prophylactic TB ha, for those who are exposed, pwede pong positive HIV, no? Pero lesser naman ang symptoms, wala namang nakitaan na problema. Pero pag nag-positive sa HIV, tapos nag-positive pa din sa skin test, no, hatagan din siya og rifampicin and PZA for 2 months. Okay, so this will be the treatment. For TB meningitis, okay, pag na-aggravate na into such scenario, no, affected na ang meninges, so the drug of choice to be given is the rifampicin. Okay, the INH is considered to be the primary anti-TB medications, while the rifampicin, INH, and the PCA would be the first-line anti-TB agent. Okay? So, primary anti-TB si isoniazid kasi pwede siyang prophylactic, no, management also. Okay? So, very, very important. So, for the nursing care, no, student nurses, determine always the history, no, history taking tayo, exposure of the patient or the family members, no? So, pag nagkaroon na ng positive, so dapat i-isolate. Yung mga gamit, hindi pwede na gamitin din ng family members, no? Yung kanyang mga clothing, bed sheets, pillows, every once in a while, no, always din siya ipainit, no? Because the mycolic acid is resistant, but it can be killed with extreme heat. Okay? Pag di pa init ni mo na siya, na ay possibility na apod tayo protection with that, no? Na i-expose ni mo sa air at saka sa sunlight ang mga gamit ng pasyente. PPD or the purified protein derivative tuberculin test and checking on the reaction is also important, no? Nang pag na-ay possibility nga ang bata, most especially for pediatric cases, na na-expose siya sa iyang papa nga na-ay TB, so si anak or ang kanyang mama, no, pwedeng mag-check din tayo ng PPD test. Okay? Pero para makitaan lang, no, na pag-expose ka, especially for children, kay bata pa man sila, low pa ang ilang immunity, pag nag-positive sila sa PPD, hatagan na dayon sila og ilahang prophylactic treatment, no, with the anti-TB medications, no, para dili lang mag-surge into problems na maapektuhan ilahang lungs. Doing chest x-ray and checking for allergic reactions as well is also our nursing care. Okay? So sa medical history taking na to, basically, the drugs would be contraindicated for severe hepatic disease, mo nang mag-check ka sa liver profile, bilirubin, and the kidneys as well, no? Such as the BUN and the creatinine. Checking for the neuropathies, no? Because that would be a problem with isoniazid, hearing changes, being ototoxic, no? And then food would also be a concern, no? For especially pag naka-INH, it has to be given. Pag INH lang ang you-take for prophylaxis, it has to be taken 1 hour after or 2 hours before meals because the food would decrease the absorption rate of the INH. You have the pyridoxine to prevent neuropathies. And the AFB is 3 consecutive morning specimens, no? Especially in the hospital kung normal nga AFB test ang ipakuha sa kanya and not the gene expert. For the eye exams, no, in relation to ethambutol and INH, because visual disturbance would also be a side effect of the isoniazid as well as the ethambutol. So you have the eye examinations. Taking the drug as prescribed is very important kasi toxic talaga siya. Not to take with antacids, you know that one kasi it coats the lining of the GI tract, thus decreasing the absorption rate of the drug. And of course, no talaga ang alcohol. Okay? So with that, another one is the photosensitivity and the rifampicin, orange-colored secretions, lots of fluids to be taken, and the oral contraceptive pills becomes ineffective pag naka-right, pag naka-anti-TB medication. So pwedeng mabuntis ang mama na nag-take ng anti-TB anti-TB medications, Kaya barrier contraceptives would also be instituted. So this one is the mnemonics, Not only with INH, but also with, of course, the anti-TB medication. Okay? You have the lungs. All right. So with that, that would be the topic, for the anti-TB. Nay pangutana? Any questions? So for the topics on Respy, I will just be posting that one on Quipper. You listen, you find time to listen to that discussion. And I will still be on Wednesday. I will be seeing you next week, because on the 30th, next week, 16. Wala, uy, copying, mandain 16. All right. November 16 is the capping pinning ceremony, So let's just check on that, But for now, I will be posting ahead, the respiratory 1 and 2 para kung mag-meet man tayo, mag-discuss, mabilis at matackle ko yung importante. Would that be okay? Kasi naatay mga days manggod on November, Like November 30 is a holiday. November 16 is the capping pinning. Ana gani, So I suppose, I hope that you will find time in everything that I will be posting on Twitter, Para at least ninyo, para sa next natin na meeting, mapag-usapan natin, kung ano yung importante. Maghamangita gyud tag time, Mr. Divino, magpa-facilitate ta ani, kaya para matackle lang nato ang like important matters on the different topics,
Apo, ma'am.
Hindi, kasi maigo manggod mo on the 16th and on the 30th, Kasi I'm making or finding time to really meet the Pharma ko, classes na ko kay pila na lang yun siya kaadlaw before the finals on December 5. All right, for the grades, I still have to compute. Next week is the encoding, so next week makuha nyo na ang grade ninyo or like over the weekend. All right? Before ko siya i-encode. All right. So naipangutana 10:37, mo post ko karon para at least the remaining time magamit na din ninyo sa pag-check. Okay? As well as the handouts for the TB discussion. Alright? Naintindihan? Keep on learning. Okay? Ang importante sa lungs, ang importante sa TB, medications would be the side effects. Huwag na siya ever since. From second year, third year, fourth year, ang importante na ma-learn talaga natin as nurses would be the side effects of these medications. Kasi doon tayo magbabantay at magbigay ng instructions sa atong pasyente in the hospital and in the community. Alright? So with that, wala na akong ibang masabi at wala na akong ibang ma-share. So I will give the rest of the time for your asynchronous sessions na lang. I will not be giving quiz muna for this week. Pahinga muna tayo sa quiz test. Okay? But expect it next week. Natay mga different quizzes. Okay, thank you for that heart reaction. So with that,